Welcome, everyone. My name is Dr. Sherry Weiser, and I co-founded and co-direct the University of California Center for Climate, Health, and Equity, along with Ariane, who you met earlier. Our center harnesses the expertise of the healthcare sector to advance ambitious and equitable climate action that reduces healthcare's climate footprint, protects health, and builds community resilience. We've been engaging faculty, staff, and students from the University of California's 10 campuses and 6 academic medical centers, and are working on climate solution ranging from health impacts of wildfire smoke and heat waves, to eco-anxiety and food insecurity, to healthcare decarbonization. And I'm really pleased to kick off this webinar as part of the 4th annual NorCal Symposium on Climate and Health, which has been highlighting opportunities in health sciences education to address the growing climate change and health crisis. And in this session, we hope to be complementing what you learned in the earlier session that was really focused on climate and health education in medical schools by considering the important role of climate and health education along the entire education continuum, from undergraduate and graduate students to other health professionals. And again, wanted to thank the faculty, staff, and students across UCSF, UC Davis, and Stanford that helped make this important symposium possible. So we have a wonderful panel today of experts who are really pioneering the future of climate and health education. And they're going to be speaking about the innovative approaches they are using to empower University of California students to address our evolving climate health challenges. So Dr. Fauna Foreman is a professor of political science and founding director of the Center on Global Justice at UC San Diego. Her research focuses on poverty alleviation, climate justice, migration and borders, and equitable urbanization. And she also serves as co-chair of the UC Global Climate Leadership Council, which advises the UC president on climate policy, research, and education. Dr. Alyssa Epel is a professor and vice chair in the Department of Psychiatry at UCSF and an international expert on stress, well-being, and optimal aging. She's director of the Aging, Metabolism, and Emotion Center, and she's also a member of the National Academy of Medicine, and she co-leads our Center for Climate, Health, and Equities, Climate Change and Mental Health Council, where they're exploring educational strategies that channel climate distress into activation. Dr. Jyoti Mishra is a cognitive and translational neuroscience scientist and founder of the Neural Engineering and Translation Labs at UC San Diego. Her lab innovates human-centered neurotechnology solutions and conducts community-partnered research across the lifespan in both local and global communities. And her research is expanding our understanding of how climate change is an acute and a chronic mental health stressor. And Dr. Mishra also co-leads our center's Climate Change and Mental Health Council, along with Dr. Epel. Finally, Dr. Batrina Smith is Associate Dean for Global Programs and a professor of infectious disease epidemiology in the School of Veterinary Medicine at UC Davis. She leads the UC Global Health Institute Center for Planetary Health that also works across 10 University of California campuses. And finally, it is my pleasure to introduce our session's moderator, Dr. Dele Ogunsetan. He holds the titles of Distinguished Professor and UC Presidential Chair at UC Irvine. He led Irvine's establishment of the program in public health and served as founding chair of the Department of Population Health and Disease Prevention. At Irvine, he directs workforce development for the Institute for Clinical and Translational Science, and system-wide, he directs the education program for UC Global Climate Health Institute and co-chairs the education pillar of our UC Center for Climate, Health, and Equity. And I would like to turn it over to Dele now and welcome all of our wonderful panelists. Thank you.
Thank you. Thank you very much, Sherry. And I want to thank everyone for participating today. It's been an exciting afternoon here in California, listening to all of the presentations. I'd like to talk very briefly about the Center for Climate, Health, and Equity. I hope you can see that very briefly. The goal of the center is to harness the expertise and leadership and all of the talents in the health sector to drive ambitious climate action for health and health action for climate. We started not too long ago, but it's really amazing to me the sort of actions we've taken and some of the accomplishments around these 4 pillars that we identified as areas of high impact. The education has been featured very prominently today, but there's research also to generate actionable evidence, and transforming the entire healthcare system is also very, very important, especially because of the footprint of our hospitals and clinics. And finally, engaging communities of practice to make sure that what we find in terms of evidence is also enshrined in policy that will last for generations. For the education pillar, which I'm particularly interested in, and I co-chair with my colleague, Professor Orlando Harris at UCSF, we have really done quite a remarkable set of activities in 2022, and also leveraging the entire UC education infrastructure to think about how we can be innovative in terms of curriculum, continuing education, professional development, and before students come to UC, we need to make sure that they're also primed to engage with this topic. Very quickly, some of the work that we've done built on early work that Sherry and team and Ariane had done at UCSF and tried to spread to the entire UC campuses. UC Davis and UC Irvine led workshops for faculty to integrate climate change into the health sciences curricular. And at Irvine, we were able to get the health sciences, pharmacy, public health, nursing, and medicine to participate. And we wrote this up for those who are interested in the various strategies. I can share that paper with you. But that also led to what we currently are doing now with courses that can be shared across the UC system. And I want to highlight one of those courses that we are lucky to have Orlando lead. And it's based in UCSF, climate change, health, and excuse me, social justice. And this is a course that we hear a lot about in terms of bringing multiple perspectives into the discussion for students, and the outcomes certainly preparing students to not just make this a one-off event, but to engage with this topic indefinitely. We heard earlier today from a speaker, Kathy Hampshire, on the Planetary Health Report Card Initiative. Very exciting presentation. I wanted to just highlight that 3 UC campuses were involved in the last rendition of this initiative. Irvine, my campus, didn't score very well, and we're planning to change that. I think part of the challenge is the omission of public health in the report card, which is where we teach a lot of the climate change and environmental health topics, but certainly we hope to transform the institution. We were also able to launch this year with the leadership of a wonderful faculty in the School of Medicine at UCSF. And certainly Emma Lasky has been supporting that effort. This is really an opportunity for students to participate campus-wide in curriculum development, and to make sure we have an archive of resources for faculty teaching in the domains of climate and health, that they have support and cross-learning across the professions. So this has been really an opportunity for ongoing engagement of student faculty teams to get this going. So thank you to those who have contributed to that effort. And now I'd like to turn it over to our distinguished panelists. You've heard them being introduced by Sherry. I'd like to just have them now say a little bit about their work before we get into questions for the panelists. We'll first have Fona, and then we'll have, I think Jyoti and Elisa are going together on their presentation, and then Katrina will wrap it up, and then we'll get into questions. I'll have some questions, and then I want to assure you that we'll also have time at the end for the audience to ask questions. But if you have questions right now, you can start typing in the Q&A box, and we will be reviewing them as we go forward. So thank you. Fona?
Thank you so much, Dele. Let me just share my screen quickly. All right. So I'm just delighted and honored to be here with you. Before I dive into climate and health education, I just want to say something briefly about my work. So I direct a research center at UC San Diego focused on solutions to poverty, notably in the communities that flank the US-Mexico border. And I was drawn as a social scientist into climate change research nearly a decade ago as I came to understand, the disproportionate impacts faced by vulnerable people across the world, including in the border region where I work. So it had really become impossible to disambiguate poverty from climate change. In our region where we work, we tend to see migration as a function of violence and poverty. And of course, this is true. But climate change is a threat multiplier here. It makes poverty and food insecurity worse. It aggravates violence and ultimately compounds the reason why people are leaving their homes and walking north. So in the center, we are now building the largest migrant sanctuary in the US-Mexico border region in Tijuana, just a few miles from our campus. There are currently 2,400 residents living here, 40% of them children. Just yesterday, we brought little Amal, this Syrian doll of a refugee girl who's walking across the world. We brought her to the refugee sanctuary. Anyway, there's a lot to say. The point is that UC San Diego will be opening a new health clinic there in January in collaboration with medical schools across Mexico as an amazing site for student training. Focused on climate migration, maternal health, and pediatrics. So that's my day job. Now let me say something about climate education. I became fully immersed in this area in 2015 when I was invited to serve as vice chair of the University of California Bending the Curve report on climate change solutions. Bending the Curve was the brainchild of its chair, Ram Ramanathan. Ram is a renowned atmospheric scientist at UC San Diego and the Scripps Institution of Oceanography. And he always understood that scientists alone will not solve the climate crisis. So he invited me and Daniel Kamen at UC Berkeley as social scientists to serve as his vice chairs on this report. And together we summoned 50 researchers from dozens of disciplines across the University of California, including public health and medicine, to develop a report that identified 10 climate solutions that California could model for the world. What made the report novel was its integration of science and technology with regulatory and governance solutions, market solutions, land use and ecosystem management, and ultimately social behavior and ethics. The report was hugely influential. It had legs. Jerry Brown carried the report with him to the momentous COP21 meetings in Paris, and Governor Newsom is now a fan of the report. So we soon realized that this report, with its amazing disciplinary clusters, could become an architecture for a UC undergraduate course on climate change solutions. We partnered with UC Online, and in 2017, the Bending the Curve was launched as a course. It's now taught on 7 of the 9 undergraduate UC campuses, as well as other campuses across the state, the US, Europe, Asia, and very soon Latin America. It will launch for the first time as a public health course, a graduate course at UC San Diego next academic year. To give you a brief overview of the course, so you understand its value and its potential for audiences to introduce the nexus of climate change and health, I'm going to share a very brief 2-minute video that was produced by UCOP for last year's COP meetings in Sharm el-Sheikh.
We can't hear the audio.
We've got to bend the global warming curve before it's too late. The only way to do that is to educate an entire generation.
California is leading the way with an approach to climate education that is already working. We are educating a generation of young people who are prepared to tackle the climate crisis. I want to tell you about the Bending the Curve curriculum that we have developed at the University of California. We focus on solutions design to bend the warming curve and also to accelerate resilience and climate justice for the most vulnerable people on our warming planet. Climate change is a complex challenge and requires equally complex and integrated solutions. No one discipline can solve this crisis alone. Bending the Curve has assembled leading experts from dozens of disciplines. They present wide-ranging topics and approaches that are essential to designing just and scalable solutions. From new energy technologies to ecosystem management, from market models to social movements, from workforce development to public health, from the way we design our cities to the way we join hands across the world. The course is modular and continues to grow, with more than 50 topics that teachers can mix and match for a course that is best suited to their students. The course is also enriched with learning exercises and an open access digital textbook. We believe Bending the Curve is the best textbook on climate solutions available anywhere, and it's free. Have a look for yourself. In this course, students become active learners, active solutions designers. This is no time for passive learning. Students are challenged to get off the campus and into the world, to partner with communities and apply their knowledge in living laboratories.
We need you. In fact, we need all of you to think about how to bend the curve and contribute to the solutions. And that's what it's going to take to solve the problem.
So the archive continues to grow with 10 new modules hot off the press on resilience and adaptation, 25 new modules on climate justice, and 4 new modules dedicated to health, including infectious disease, pediatric health, mental health, produced by Dr. Jyoti Mishra, who's on the panel with us today, and a brand new climate health and equity module, a real overview produced by CCHE. CCHE is also working with the AMA to make Bending the Curve materials broadly available to health professionals. And our goal now is to see medical schools and public health schools across California pick up the course and make use of these incredible homegrown resources. So if you're at all interested in seeing Bending the Curve arrive at your school and in your department, please reach out. We'd love to talk with you. Thank you so much.
Many thanks, Fana. Jyoti and Elisa.
Thank you so much, Dele. Thank you, Fana. We are so inspired by Bending the Curve, and it's actually inspired one of our projects, which Jyoti and I will get to talk about. My name's Elisa Eppel. I'm a professor in psychiatry and behavioral sciences at UCSF, and I study stress and trauma and health. And we have been starting to understand the landscape of climate and mental health and climate distress. So as part of the Center for Climate Change and Health Equity across the UCs, many of us have been meeting and asking what are some common interests? How should we represent health, mental health across the different pillars of the center? So we've met with faculty across campuses and have realized there is a strong synergistic interest in mental health and climate. both the effect of climate traumas on mental health. And there's some amazing research. Of course, it's so important to California with our floods, droughts, and wildfires. And you'll hear a little bit about some of that research from Jyoti. There's also the effect of the chronic bad news about climate and natural feelings of distress and anxiety. So climate news, which is more of a unfortunate, frequent or nonstop barrage, is affecting the mental health of people as well, particularly our youth. And so we have been talking with faculty who are teaching sustainability classes and other classes, and have come to understand that students need resilient skills to go into this field and to go into be launching careers with the concurrent intermittent climate crises. They need some skills they're not typically taught. So we have started a course being inspired by Bending the Curve on helping students build climate resilience. We have focused on 2 goals, and that is developing inner skills for being, for really living with sadness, grief, climate trauma, while being an active participant in the change process. So we are going to be teaching undergraduates and really graduate students as well across UCs the knowledge and skills for psychological resilience and enhanced emotion regulation in the context of climate change and climate trauma, as well as how to use nature and nature connection for restoration. And our second goal is to help them with outer skills, that is to become a climate action ambassador for coping with the climate change, the meta crisis, the environmental injustices. So they'll be learning best practices for climate communications and advocacy. They'll be assimilating the essential concept of think global, but act local. So like Bend the Curve, they'll be involved in local projects, particularly with advocacy. And they will be instilled with the understanding that climate action is the work of a lifetime. We'd love any of you listening to, if you have an advocacy related project that you think could involve students in California, we would love to hear more from you. If you want to be a campus faculty representative of our class, we have at least 1 faculty from all UCs. We would love to have 2. Our model is a flipped classroom where we have world-class speakers on video, like Bending the Curve, and then we have small groups with UC faculty and certified mindfulness teachers so that they can actually have an experiential class, both in discussion and in practicing resilient skills. And so with that, I would love to turn it over to my amazing colleague, Jyoti Mishra, who is the co-chair with me of the CCHE Mental Health Council for Climate Change. Welcome, Jyoti.
Thank you, Alyssa, and it's really an honor to be here. I've been inspired by Dr. Foreman and Dr. Ram Ramanathan's work for a very long time. I was trained as a neuroscientist, and people ask, like, what am I doing here? And, about 5 years ago, the wildfires in California became such a frequent event that they became like an annual occurrence. And the deadliest wildfire that California faced, the Camp Fire, happened in 2018, which is when I picked up a phone call to a community member in that region and was asking about the impacts and hearing about the terrible distress and climate trauma that people were feeling in our communities. That surprisingly, the scientific literature has not really characterized. And that started my own journey in research in this field to really understand what are the mental health impacts, because basically our mental health is what helps us get back up on our feet and rebuild after a traumatic event. And so it's very important that we all have the resilient skills for the long fight that is ahead of us in terms of climate change and really enabling the climate solutions that the fantastic course that Bending the Curve offers. Really, it's been very fortunate that over time I've had the opportunity to continue to work with communities to not only describe the mental health impacts, the neurobiological impacts. In fact, our work led to the first study of what is now called the fire brain phenomena, and how brains do differ when impacted by wildfires and in a chronic way. But the good news is that brains are plastic, and in that change is possible, and there are ways that we can really look into both inner work as well as outer work in terms of engaging with our communities in order to bring resilience to ourselves. And that's exactly what Alyssa and I aim to do. And Alyssa provided a great overview of the course. There'll be didactics from world-class experts on the mental health and psychology of climate change, how to deal with the information that's coming out in the news and media, and how to use that to empower ourselves towards greater community action, and also how to process everything that's happening, and also the inaction that might be happening from the policymakers. How do we process that and channel that towards more work that is needed? Alongside the international experts, there will be faculty members as well as mindfulness teachers supporting the effort. And we are also making partnerships with community partners that students will engage in student projects. And this course is coming to the UCs in this academic year, and very excited to work with Alyssa and the Mental Health Council to do this work. And if any of you are interested in leading any aspect of the course in terms of community partnerships, mindfulness teachings, please do contact us.
Thank you very much, Jyoti. And now let's hear from Valtrina.
Sure. Hello, everyone. My name is Valtrina Smith. I'm based at UC Davis. I'm a veterinarian. I think part of what really brought me to this area of planetary health, the climate crisis, working on solutions came both from growing up in Alaska and realizing the populations around the world of people and animals that are growing faster than our planet will be able to sustain is really on the level of a pandemic as far as existential threats to our survival and to our children and future generations. So certainly that's a big motivator in wanting to know that we're preparing the next generation of problem solvers in how they can be part of solutions. And I love hearing the examples so far, both from the general, that we recognize there are problems and we really need to work together across different disciplines to be able to find solutions that make sense for communities to think globally and act locally. I think those are all the same types of approaches that we've been using at the Planetary Health Center. Let me just give you a few visuals because I find that always helps me stay engaged as well. So the UC Global Health Institute works across the 10 UC campuses. One of the things I love about being involved with that is that I am working with social scientists and other natural scientists in different ways on a regular basis. So I have wonderful leadership partners at UC Riverside with Samantha Ying, who's a hydrologist and soil scientist. UC San Diego is the basis for Georgia Kaiser, and her work in water and health is wonderful. And Federico Castillo as an environmental economist based at UC Berkeley, just to give you a taste of the types of ideas that we're working with as we try to inspire students to get involved, as we've already heard a little bit. So I will just share a couple other examples of things that are happening with the hope that that inspires both others to want to get involved and to come up with ideas on how we could do it better. So I think when we think about sharing ideas, coming up with solutions, what are we doing now that could continue to go forward in interesting ways and innovative ways? The UC Online process of developing courses is also one that the Planetary Health Center has engaged with. And the Global Population Health and Environment course that we offer every spring has been a good way to both have cross-disciplinary topics coming up around climate and health, but also project-based solutions and videos made by student groups on what they think we should be doing. What will the world be like in the future? How can they be part of really making it a place that they want to be? So those sorts of courses in the classroom and in an online space, often flipped classroom designs, I think are quite helpful, but also complemented by conferences, professional opportunities, summer experiences. and really thinking about what we can do here in California that can be linked to our colleagues around the world. So I work across many different countries in Africa and Asia and the Americas with some of you who are on this webinar. And really what I love about that is the chance for realizing we have so many things in common. We are facing many of the same challenges, but maybe we need different types of solutions to really make sense in those communities. And when we find things that work, perhaps other places can try them and see if they would be helpful there too. So a few of the other things that are happening here, when we think about collaboration across disciplines, and I think I saw a question maybe come up about how are we engaging some of the clinicians and health professionals in this space. The Medicine for a Changing Planet is one nice example, Stanford, University of Washington, but then a lot of us from other organizations as well were involved. And these are clinical case studies, so developed with a problem in a human patient in those cases. And that is an entry point for talking about the climate and health issues and bringing in social justice and environmental justice as part of those conversations. We do that a lot in our veterinary teaching as well at UC Davis and elsewhere, thinking about problem-based learning so that we can really help people engage with a starting point that is very familiar and hopefully personal to them, and then take them into that systems thinking and the ideas that really need to happen in order to develop innovative solutions. So case studies are one thing, hands-on experience is huge, as we all know. And so we're trying to target the summer window when students have flexibility to support them to get out across the state of California, sometimes to get out to partner countries and colleagues around the world, and really support them in summer work experiences. And that is opening both ideas, but also career paths in ways that they had never expected. And all of them produce short videos that help to share their ideas with others who might want to do this in the future. So that has been a really relatively easy but nice takeaway that I think I would recommend to others. The students are so creative. So if we can empower them to make a 2 to 3 minute video on what they did and why it's important to them, I think that's really what kind of makes me cry each time, because it really is very touching. So other ways we do hands-on, short courses, field courses. The RX One Health Field Institute is an example of that we offer every summer. That will continue to happen both in California, and then hopefully we'll be able to do that internationally as well in coming years. And then the last project I'll mention, which really takes those ideas and a lot of what we've been talking about across 100 universities in Africa and Southeast Asia already, is called the One Health Workforce Next Generation Project. And so that has really focused on training that was funded for global health security. And I think many of us can realize that it's not just infectious diseases that are part of global health security. And so now we've seen a real broadening in the interest from funders to get the climate and health, the planetary health into the mix because of this huge looming issue of the climate crisis and what that's going to mean in communities we work in. So I am certainly a big believer in flexibility with online learning, but hands-on, get people out into the communities and really think about how they can be culturally sensitive, humble, and always learning and sharing with each other as we go along. The last thing I'll mention is a training platform, which is available to anyone for free around the world. And this is a place where we could perhaps post a Bending the Curve or host a Bending the Curve type course, because we don't have that yet. But this training platform, One Health Workforce Academies, does currently link our learners across 85 different countries have participated in these things, which are online courses and case studies and lesson plans, et cetera. And also for continuing professional development purposes. So happy to follow up with that. And Dele is a leader in this initiative, so he's a good connector for all of us as well if there's interest. I'm going to stop there. Thank you all, and I look forward to the discussion.
Thank you very, very much, Katrina, and to all of our panelists. Now, I'm going to ask you a few questions, and we'll proceed in the same order, but I want it to be conversational. So if somebody says something that you'd like to respond to, please feel free to do so. So all of us are on screen now, and we are getting questions also from the audience. So why don't we start with a broad view of what's inspiring you to pursue this work for education in climate change and health? And if you have thoughts about gaps that you're specifically addressing, that would help. And also to think about, what is different or unique about your work. Fauna, do you want to start?
Sure, I'll start. So I began to realize several years ago that speaking about climate change through the lens of health was a way to depoliticize the issue. So as a political scientist, we're studying sort of barriers to, social acceptance or barriers to, political action around climate change. And typically it's because climate change is linked with a bunch of other issues that people find problematic politically. So there's a tendency to think that, if you hold a certain sort of socioeconomic view, for example, you have to then have a corresponding view of climate change. And so you see these sort of issues hanging together politically. What health does, and refracting the issue through health, is it generalizes, it universalizes the problem. It universalizes the challenge, so that we all need to be thinking about cardiovascular disease. We all need to be thinking about, childhood health. And so I'll just give just a brief story. I was at a global summit at the Vatican focused on climate change and health. And this wonderful leader of the American evangelical movement stood up and he said, look, my community wants clean air and clean water. He said, but as soon as you want to take this issue and put it inside of your abortion tent, in your gun control tent, and so forth, you lose us. So let's figure out how to join hands without having to tick boxes across every single political issue. For me, that's very difficult, but it's a skill that we need to learn how to build bridges that are not politicized. So the health lens seems to be a powerful way to do that.
Thank you. It's a way to coalesce the advocacy and not make arguments where it's not necessary. Thank you. Okay, Elisa or Jyoti or Katrina, you can chime in.
Okay, sure, I'll go. I love these questions. Coming from my lens as someone who wants to help people cope with stress and trauma, this is very different. Existential stress, the threat of climate change, we don't want to take away people's distress. It's actually what motivates them. And so the dark side, or the biggest problem here, is the feeling that you have no control, and thus you want to avoid, deny, not pay attention to, become depressed about it. And so the loss of hope is our biggest enemy, and especially for our youth. And so in studying what can I do from my lane to help with this climate change crisis, I have come to understand the importance of climate awareness, discussions, advocacy, and embracing the model of social change happens because you as an individual matter more than you think, working with other people. And so that's how we came to this idea of a class where there's not an individual reading and an individual project, it's all group based, so that people can actually express their grief, their doubts, their fears together, and see that we're all in this together, and move from that, from distress to action toward a project. So the idea of doing more research and incremental research on climate and mental health, while research is always important, particularly research illuminating health, what we need most is understanding advocacy and models of change. And that's where our youth and young adults come in. They are, as we heard so eloquently from the Children's Trust or Foundation, the youth's voice and that their distress is one of our most important legal tools, the harm done to them and their expression. So I'll just stop there.
Thank you. It's alarming,
you.
but it's also inspiring. And thank you. Jyoti, what inspires you? You talked to us about mental health issues, and say more.
Yeah, absolutely. Besides studying mental health, for a profession, my own mental health journey has always benefited from the community that's around me. And whenever I felt isolated, reaching out to others and being involved in collective processing of an issue, or even seeking support as to the tools that are out there in our communities has really, benefited my own mental health. And I clearly see that even scientifically, the solutions that are out there for individualized mental health, like pharmacological solutions, they don't work as well. But when we think about community-based solutions, especially to social issues like climate change, there is a lot of scope for improvement at the personal level and at the collective level, that we can together solve this problem, but not alone. And that's how that concept has really impacted my own flourishing, is something I want to contribute to the community around me.
Thank you, Jyoti. Vatrina, you talked about growing up in Alaska. It's the only US state I've never been, so I'm inspired now to go there.
You're always welcome.
Thank you. You're also, I think, here, our veterinary medical doctor, and concern about animals and welfare is certainly risen up in climate. But let's hear more about what inspires you and what gaps you are addressing.
Yeah, I think some of the real drivers or inspirations for me have been recognizing through experience the power of collaboration, learning from each other, coming up with solutions together that maybe we wouldn't have thought of or worked through if it was any one of us by ourselves, which we've already heard mentioned. So I think that's really powerful, and that is probably the way of the future as far as really how we should be training our students to be prepared to innovate. So collaboration, I think the idea of thinking globally but acting locally, what's our own individual positive contribution that can help to move forward or can activate others as a catalyst. To me, that's really important. And I think in the space of training innovation, which is something that I know a lot of us are wanting to keep pushing the envelope on, I mean, something like many of our universities probably have a master's in global health type thing, right? Various little versions of that. What if we truly had a global master's in health, where we were partnered with our colleagues around the world talking about these issues, right? That's really fascinating from an idea of how you could use something like the Bending the Curve course and ideas to really get these conversations going in parallel in so many places where we now have partners. I think that's super exciting, because it really is only by all working together that we're going to be able to tackle this appropriately. Now, if one of my partners from Tanzania was sitting here, he would say, I don't have the luxury of thinking about some of this stuff and working on this stuff, because poverty and some of the big drivers that should come above these intellectual spaces, as he would say, is what keeps him up at night. So I do think some of the ideas we heard at the very beginning about really recognize the importance of the connectivity between these different aspects of community, and then the longer term view that we want to think about, but we also have to think about today and tomorrow for the people we work with and for our families and livelihoods around the world.
Thank you very much. Interprofessional collaboration and partnerships, and there are big gaps there, and you've helped us think differently about how best to proceed. Certainly of interest to the center that is hosting this session. I'd like to now ask you to reflect on the impact of your work, particularly for communities. I think, Vatrina, you started talking about that in terms of poverty and priorities. And when we are asking people to change behavior, we need to have some context, particularly around something that may be future-oriented, but it's no longer the future. Climate change is here. Other kinds of impacts and hopes for your course. Let's go back to Funa.
Sure. I think, one of the dangers, obviously, of the accelerating existential threat is that young people can feel powerless, and they feel just a grain of sand in a very large problem. I think that when a course is solution-centered and community-based, particularly in local challenges, the student can see that they actually can have an impact. one of the benefits, I think, of local work is because it's sort of where the rubber hits the road. And when the crisis is so large, having small incremental change visible to the student, I think helps overcome that sense of paralysis. And so I was fortunate to actually partner with Jyoti over the last years to do an assessment of the students who are taking Bending the Curve. And it has a huge impact on relieving their sense of disorientation. Students today want their lives to matter more than any time I ever remember in my 25 years of teaching. Students, whatever field they're in, they want to ensure that whatever they're doing with their lives will have a positive impact on the world. And it's really very inspiring, but it can also be overwhelming for them. So gaining tools at this stage as they're beginning to imagine their next selves, I think relieves a lot of the anxiety. So this is what we're seeing in the courses.
Thank you. Anybody else want to? We want to make sure we cover as much of the audience questions before we wrap up. But I have a couple more questions. So.
I'd say that our frontline communities are leading the example of what is resilience, because they do not have the luxury, like what Trina said, to be engaged in didactics and learnings, but they have to invent themselves every day to deal with food scarcity or water scarcity or excess heat or wildfires. And one of the most inspiring quotes that I got from the Campfire community was that I survived because the fire within me was burning brighter than the fire outside of me. And we're working with these same communities on the solutions. And I think there's so much to learn. It's not just that, we will be offering education to them. They're offering education to us and for the youth of today. And what's been a common theme here, going at community-based collective solutions. And I think engaging our youth and having them meet with these frontline communities can make great things happen.
Thank you.
Yeah, maybe one comment to add from me. I think when we think about how to scale solutions or inspiration to come up with solutions, one of the things I think has been very powerful, as Dele will relate to, is I would say most, if not all, of the universities that we work with across these countries in Africa, Asia, and the Americas have student One Health clubs. Slightly different names, but One Health innovation clubs. And those students, just like we heard from Fana, they want to do something, right? Let me get involved. Let me figure out how to matter in ways that make sense here. So I'm just mentioning that now because I think that is a little bit of a framework or a structure that we could tap into for some of these ideas and kind of inspirations that may come out of things like the activities and the people that are involved in this webinar today. So happy to make introductions there or figure out how we can share materials in a way that would make sense for those LMIC settings where now we have really good relationships.
Wonderful. Thank you. Elisa, do you have a word or two to add?
I have nothing to add except for the common threads across all of these, my amazing colleagues, is a beautiful story that makes me feel like we're all, we're working in a very potent area that is desperately needed for our youth.
Thank you. And listening to that and to all of the conversation and questions going on today, it would appear as if we're doing everything we can. And if we are able to see far in the future, we would be able to know if we're actually being relevant and impactful. But we probably have gaps in what we could do. Resources are always limiting. But so I'd like you to think about this question as we try to wrap up here. Where does education in climate change and health need to go next? What are we missing? And your own personal vision, over the next decade or so. And what should you see, maybe your campuses or UC system-wide should be doing as we pursue this topic?
So I can just dive in. I am so proud of UC San Diego for just passing the first general ed climate change requirement in the UC system. Every undergraduate will have to, and we're defining what that means. It's going to take time. There's a lot of debate, right? Look, is it just a straight science class? Does that count as a climate change course, or does it have to be more integral and bring in social, ethical kind of dimensions and so forth? So we're gonna battle that out. But requiring climate change education for our students across fields is a very good way to begin. And then one aspiration that I have, and Utrina earlier used the idea of humility and this beautiful story of Jyoti, the fire within versus the fire without. We as researchers at the university need to learn from communities. It's not just unidirectional. And we need to bring the knowledge that these communities are developing as they're battling these challenges into our teaching, into our research, so that the learning is going in both directions. I guess that would be my aspiration.
Thank you. It's a free-for-all. Anybody else?
Well, I can add one on Fauna's there, because I would say that some of the funders are following your lead on that one. So what we're seeing is some of the decisions that were made about US government investment, and I'm sure this is happening on the private sector side too, were made centrally here in the US. We're going to tell you what you should do elsewhere. We have the solutions, right? And then we'll figure out, well, how well it works. And we were actually seeing that flip. And so some of the funders are now saying, sure, we're going to invest from the US in these other countries for these, important reasons, but the decisions on what should happen are going to be made in those countries. And so that idea of localization of decision-making, of decolonizing or democratizing global health by really empowering folks who are in the communities or are in the countries and settings where some of these things are really coming to a head in ways that you and I might not necessarily imagine or predict exactly, right? That's why they need to be able to recognize problems, come up with solutions, be empowered to really try that out, and then figure out what's going to work best. I don't think we can ever have all the answers, when we sit at our desks and try to work or forecast what that's going to look like. So just knowing that that's okay and that we are a global community, to me is pretty important.
Thank you very much. Jyoti?
When we think about climate resilience, there are scientifically and policy-wise 3 basic pillars. And of those, there's mitigation, where we avert future risks, adaptation, where we try to adapt to the changes that are already happening. And the third very important pillar is social transformation, where we have the collective will to make the changes. Many would argue that the technologies are there, that we can curb the warming, and as Fauna's course clearly states, bend the curve. But we need this social collective movement, and that's what we're creating together with the coursework that we have. And the coursework is not just meant to be didactic. It is immersion within communities and taking action and making students feel that they are part of the solution, part of engaging and enacting the solutions, not just learning about them. And sustaining this kind of effort, educational effort, will be what students will then continue to do in the next phase as well. And that's what we hope will happen over the next few years.
Mhm.
Thank you very much. Your vision, Elisa.
I'll just add that our lens, we've heard about so much amazing work globally, and we all are embedded in institutions that need the social transformation, the awareness raising, and the change. And so this kind of inward look at everything we do with fresh eyes, how we are using, of course, how we're using fossil fuel resources at UC. That's a whole nother topic. And we have amazing activist colleagues who are trying to help with that, but how we also use travel and food and local vendors. So I was part of a movement to get rid of just one thing in our food and beverage service across all of our hospitals and campuses at UCSF. We got rid of sugared beverages, and David Cleveland and Jenny Jay, and sustainability colleagues at Santa Barbara and San Diego, they calculated what is the greenhouse gas emissions that we have saved through these different changes on different UC campuses. So just by getting rid of the packaging from so many of these I'll say toxic liquid sugar beverages, we reduced our greenhouse gas emission by 2%. So for people seeing that these small changes do add up and that we need to really be changing our own culture, our behaviors, our carbon happy lifestyle. And so for me in my field, we have been talking about how do we incentivize all of us who are in our silos. We have demands on our attention, competing topics, competing resources. How do we bring climate to the top? How do we help all of our colleagues insert it when it's possible into their classes, into their research, into the incentives in our types of jobs? Like changing areas is hard. And so how can we give people credit for adding some advocacy or work on
priority? Absolutely. Thank you very, very much. There is one question, at least from the audience. It's about how to incorporate environmental justice in a practical way. What does that look like? So I'm going to give only one of the panelists an opportunity to respond because we want a brief break before the next session. So who wants to tackle the environmental justice question? I think it's been a theme that ran across all of your presentations. There is no easy way to put it that the impacts of climate change are going to be felt disproportionately, not just within the United States or within California, it's also across countries. And I think as we do our research and educate students who have a more global interest or community engagement, that their awareness of injustices in the policies, in the implementation plans have to be taken into consideration. And there are scholars who've written a lot about this. So I'm going to respond to you, Paulina Navarro, who asked that question with some readings. I really want to thank all the speakers for their time today and really thank all of the attendees. The webinar was recorded and we look forward to sharing the recording with attendees very soon. So now please join me for the 5th and last session of today's NorCal Symposium. I'm a guest of the Northern California Alliance. We're starting at 4 p.m. Pacific Standard Time, where we'll hear from the leadership from UCSF, UC Davis, and Stanford University. Thank you all very much.